Good afternoon, and thank you so much for joining our webinar today, Building Partnerships with Patients and Families in Adoption of Choosing Wisely Tools. My name is Marilyn Francis, and I'm the Project Director for the Transforming Clinical Practice Initiative at the Patient-Centered Primary Care Collaborative, or PCPCC. PCPCC is a support and alignment network in the TCPI initiative, and we provide a system for workforce development using national and regional professional associations and private and public partnerships that are currently working in the practice transformation efforts. But before we start, before we begin, I just wanted to do some housekeeping. First of all, we will be sending you the recording of the webinar, and it will also be available on the PCPCC website. We really would like your participation, so please participate in the conversation by adding your comments to the chat box. Feel free to do that. And we also will be doing a Q&A at the end of the presentation, but feel free to submit your questions at any time during the presentation. And now I'd like to introduce our wonderful speakers today for this webinar. First, we have Kelly Rand, who's the program manager for the Choosing Wisely campaign at the American Board of Internal Medicine Foundation. We also have Mary Minetti, who's the senior policy and program specialist for the Institute for Patient and Family-Centered Care. And then Kelly Slate-Cabbage, who's the program manager for the consumer engagement at the Maine Quality Counts, which manages the Tri-State Northern New England Practice Transformation Network. And so with that, Mary, I'd like to hand it over to you.
Great. Thank you so much, Marilyn. And thank you, all of you, for being on the call today. I know you have very busy schedules, and making time for this, we really appreciate it. So in today's webinar, we're going to really provide you with some information so that you can understand how Choosing Wisely can be a strategy for improving care in your organization and enhancing your patient and family engagement. And we want to give you some real practical examples of that. And then we've developed a tool that we think will assist you in inviting patients and families to partner with you as you implement Choosing Wisely in your practice. The time will go quickly. I know that that will be true. And so this is how we're going to kind of cover the time, and we will leave time for questions and answers. But as Marilyn said, please feel free to chat in your questions as we go, because if we can, we'll answer them as we go along. The time will move quickly, I know that, and so the important thing is to put, and that's what my conversations in this next little bit are going to do, is put it into context. You're involved in the TCPI program, and it's all around promoting broad payment and practice reforms in primary and specialty care, really improving quality and reducing costs, really connecting with the community and providing care coordination for some of our most patients with diseases and conditions that are difficult to manage. But one of the key aims, and there are many in the TCPI program, but one of them, and one that we'll focus on today, is we really want TCPI programs to really sustain efficient care delivery by reducing unnecessary testing and procedures. And as you'll find out from the two Kellys, Choosing Wisely really can be an enabler and an assistant to you in that, realizing that aim. The other thing that we always want people to keep in mind, and this is near and dear to my heart, is that person and family engagement is the way we do our work. And it has become a strategic framework for CMS. And in all of their programs, including TCPI, but also the HIN program with the hospitals and their patient safety programs, and some of their other innovations, they're really looking and leading in developing partnerships with patients and families. Quality payment and realigning payment to align with what we really value is important. And what you'll notice is that PFE is a primary driver in some of that change in the way that we do payment. And many of you are paying attention to the quality measures, helping organizations move into ACOs, and helping them with improvement activities. And what you see in this slide is the many different ways that patient and family engagement is aligned with that payment reform. Engagement is all around creating partnerships, and what we want to do is we want to create those partnerships in direct care and also in organizational design and governance. And if you look at this continuum of patient engagement, what we really want to do is move from the left side of this slide of just giving information to patients and families to moving toward partnership with them so that we really co-design care plans together. And that in addition to surveying patients using CG CAPS and other survey tools to see what's important to them and how they are experiencing your care, which is a one-way flow of information from the patient to you, the best practice really is for them to help us co-design the new healthcare of the future. We have a number of metrics that you are measuring over time related to governance, point of care, and policy and procedure. And I just want to bring to your attention that many of these metrics are supported by Choosing Wisely. We're going to talk about how to engage patients and families in implementation, but Choosing Wisely is a tool around shared decision-making. It certainly increases people's activation, and their materials are very much aligned with the best practice for health literacy. So this, I know, is a busy slide, and Kelly from Northern New England PTN is going to talk in a little more detail about what they've done in their area to link these things. But what you see is, again, that Choosing Wisely can really help you meet many of the TCPI requirements, from the change tactics to how you're reporting on your practice assessment tool milestones, and I've already talked a little bit about the metrics. What's true is that leaders across the country are saying that they've had stunning levels of improvement performance when they really invite patients and families to be in positions of real power and influence, both within their own care, but also as it relates to how we improve the systems of care. And that many call it the single most powerful transformational change agent. It really is an accelerator. There's extensive evidence out there now about why person and family engagement is important, and there was a recent, in the last year, National Academy of Science, Academy of Medicine study on harnessing evidence and experience around changing culture to a more patient and family-centered care system. But some of the evidence really leads us to know that the engagement of individuals and their families improves not only their care and their success in self-management, but it also helps us achieve some of the aims of TCPI, like reducing rates of hospitalization, emergency room utilization that's not appropriate, but more importantly, helping return the joy of practice when we're interacting with our patients and families in ways that are mutually beneficial. Some of that burnout and job stress is reduced. And as we think about the whole issue of creating partnership with patients and families related to goal setting, what we know is that we want to make sure that we identify decision aids that can help us develop those and co-create those care plans, that we really make sure that we engage patients in understanding and agreeing about what makes sense and what matters to them. And that process of reassessing goals, doing more goal setting, updating, is really informed by decision aids. And the reason for that is that what we know is that in literature that's been well researched, 40 to 80% of the medical information that patients receive is either remembered incorrectly or has been forgotten. And so we want to make sure that we create opportunity and tools that are going to help create an environment where patients are better informed, where the communication with doctors and other care team members are improved. And we believe, and the literature shows, and Kelly's going to talk about this in more detail, that the Choosing Wisely tools will really help you achieve some of those really important goals that you have for your practice and for your patients and families. So Kelly's going to share with you everything she knows about Choosing Wisely. Kelly?
I hope I can at least share some in my 6 slides. But I'd like to start off with talking about choosing wisely, just giving a level setting. I imagine if you've come to the webinar today, you've heard of choosing wisely. You know it has to do with overuse. Maybe you know about the 5 questions. But I think understanding the history of how choosing wisely came about gives you a better idea of how well it fits into patient and family engagement. So choosing wisely was founded on the idea that there was too much overuse in the care system, and that we needed as a healthcare system to do something ourselves before other people came in, that we needed to do the right thing. So the ABIM Foundation partnered with specialty societies to think about the idea of what kinds of conversations specialty societies wanted to have with their patients that they weren't having. And we asked specialty societies to come up with 5 things that doctors, or it started with doctors who've gone past that, but what clinicians and patients should question together. And so the very center linchpin of Choosing Wisely is all about inspiring conversations. As the campaign has progressed, we have kept that idea of co-creation, and we've seen it evolve from just a patient-clinician conversation to spreading conversations throughout the community. So it's not, while we see I kind of think of it like a stone going into a pond. The center of the stone where the ripple starts is the patient and clinician conversation, but those conversations spread out to the care team, to patient education classes, to community groups talking about healthcare, to the greater delivery system, payers, and government. And I think we've learned some lessons in how we've done that. So one of the first things that we've learned is that this is culture change, which is why it's important that it can't just be the health system alone, but it has to involve the entire greater culture, which believes that more is better as a whole. And the alignment and values of framing the right thing to do also aligns around the idea of while we are trying to address overuse, we're trying to address overuse because it's a patient safety issue. It's the best care that we can give, and it's the best care to receive. I have simple rules on there. When we engage the specialty societies, we were not prescriptive of what we wanted them to do. We really did just say, we want you to come up with 5 things you'd like to be talking more about with your patients. We wanted them to be evidence-based. We want you to be transparent about your policy, your process in getting to those 5 things, but it's your field, go with it. And I think transcend out with how people implement it in the community and how people implement it within the health system, that there are some underlying truths to it, but it really needs to be tailored and catered to the community that you're working in. One of the key things that we've seen that it needs to be there for things to work is engagement and partnerships, both within the health system and within the community. And we have just finished a $5 million grant supported by Robert Wood Johnson Foundation, where we funded communities across the country to work. And from every single grantee, one of the things that we heard and saw within their metrics, in order to make significant reductions in overuse and make changes in culture, there's a need for patient and family engagement. Now, one of the things we have also learned about how to engage is that sometimes when we've gone in and we've started the campaign, there's resistance. So we hear from health systems and clinicians sometimes, patients want us to tell them what to do. They come here for the information. This is what we do. So we had partnered with Consumer Reports, and we did a fairly large survey of several thousand people. And what we learned is that the things that patients value the most when it comes to overuse is they want communication with their clinicians. They want to talk it over, and they want to participate in making their care decisions, but they need access to information, and they want that information from their clinician. The messages that seemed to resonate with patients the most were when messages were focused on safety, not so much on cost. They want those messages communicated in plain language, and those messages were achieved best when they received them multiple times. So whether it was multimodal messaging throughout the care system, hearing it from community groups that they trusted, hearing the message repeatedly helped conversation go more easily. I also think one of the things that helps the conversations is that we have evidence-based patient materials. One of our major pieces of patient engagement materials is the 5 questions. We heard a lot when we first started that patients want to be the ones to start the conversation, even if their clinicians don't, but they weren't sure what to ask. So we Consumer Reports developed these 5 questions for patients to give them an idea of what to say, but also to give them permission to be the initiator of a conversation. And last year, we did a survey to see whether those questions were effective. So Consumer Reports had about 4,500 of their subscribers use the 5 questions within a certain amount of time and then give them feedback about what happened. So 20% of those people said they changed their opinion about what to do as a result of asking questions. 22 said that they changed their plans about their anticipated treatment. 88% said that their doctor was open to answering questions, and 90% said that they would encourage their families and friends to ask the questions. Now, Consumer Reports subscribers are a specific demographic, and I think probably a demographic where they feel they're obviously buying Consumer Reports, so they're an engaged consumer already. But if we're able to get this group to work, it's a good sign that these materials are at least a stepping stone for other groups. So there needs to be more support for them and encouragement for more marginalized groups. We also worked with Consumer Reports to create topic-specific brochures. And we wanted to be able to give the idea of overuse, what options people had, and an understanding of it in very plain language. So we originally had them written at, I think, an 8th grade level. We tested them. That was a little bit still too complicated, so we did a low literacy version of them, and we retested them, and we found that with 3,000 adults, prior to reading the brochures, interest in the topic was low. So say for low back pain, it was 14%. And after reading, interest was as high as 50% for someone who didn't have low back pain, and as high as 72% for someone who did. And 75% of the people felt the brochures had enough information to help them make a decision. 65% indicated that the brochure taught them new information. 64% were willing to have a conversation with their doctor, and 43% changed their opinions. So we think that they're solid pieces to help with the conversation that's so important. As I mentioned before, we just wrapped up a fairly large 3-year grant with 7 communities across the country, and we want to share those learnings with health systems, clinics, or teams that are interested in implementation. We are going to be running a breakthrough series with PCPC State for 5 to 10 healthcare teams, and we'll be having an informational webinar next Tuesday at 12 p.m. for more information. The flyer is also included in the handouts, but what we hope to do is share the learnings that we've had from the grantees, and also take these teams through at least one PDSA cycle in trying to make some changes. Kelly Slate-Cabbage was one of our grantees, and I think she has a lot to share about how they put these materials into use and how they put the principles of choosing wisely into use. So I'm going to turn it over to her to give some real live examples. Thank you.
Great, thank you, Kelly. I just want to say hello to everyone out there. And as I work on changing the slide, there you go, and we'll get to it. I work for Maine Quality Counts. We are a member-driven nonprofit. We're located in a small town of Manchester, Maine. And what we do is we are working to improve the health of all Maine people and beyond by transforming the way healthcare is delivered. And also, I work for our Northern New England Practice Transformation Network. And as you can see, our network consists of 3 states, Maine, New Hampshire, and Vermont. And it's a very rural area. And we work with approximately 337 practices, 93% of which are small and rural. And they obviously, as you can see here, spread across all 3 of those states that you see in view. This is our experience timeline. We were fortunate enough to be one of the first grantees through ABIM Foundation back in 2013. So we've been working with Choosing Wisely for quite a while now and have actually garnered a lot of lessons learned, a lot of what are the challenges working on both the clinical side as well as our large community engagement and cultural movement forward side of the program. So we initially had a pilot with 4 primary care practices. We had 5 different focus areas, and basically it was really trying to figure out the general use of Choosing Wisely and integrating that into the practice workflow, helping the practice team become familiar with the foundation of Choosing Wisely, how we could utilize the entire practice team for a team-based approach to incorporating Choosing Wisely, and then beginning to understand the process flow from the patient perspective. We also provided sample scripting for the practice team, and we would actually go through the different types of roles that each team member could have in this process for team-based to help them gain confidence in incorporating this type of a conversation into the workflow. It was new for them, and we really had to go through a learning collaborative sort of approach to actually practice how we would utilize the team. And we also brought in patient advisors to work with us and actually did some role playing, because it was very helpful to have the insight of a patient advisor from the very beginning. And so we would, practice how a patient would go through the visit and, look at the different scripting, look at the flow, how did the patient feel about this? So it was very helpful from that perspective, something I would very much recommend. And working with the patient advisors at the practices, they specifically worked on creating tangible ways to engage patients in their own care through Choosing Wisely. And so they would think about ways, okay, when a patient first enters, what should we have there for Choosing Wisely? And on my next slide, I'll kind of show you the different ways that our practices are utilizing visually Choosing Wisely to ensure that patients are brought right into that culture right at the beginning. And then also it helps remind the practice team about utilizing Choosing Wisely, the 5 questions for the foundation. And also with the patients, they really got into educating others in regards to why more medicine is not always better. And so before I go to the next slide, our initial pilot, then we had a first spread into, at the time, the state innovation model. It was part of our patient-provider partnership on shared decision-making. And so we focused our work on low back pain and the general use of Choosing Wisely into the workflow. We had a total of 10 pilots in that project. And then our second spread, we went into dealing with that hard question number 5, how much does it cost? And so there again, and I'll get into more detail, we had 3 health systems work with us. Excuse me, I'm jumping ahead. This is with our current Choosing Wisely initiative, which was both clinical and then also on the community engagement side. We had three health systems and two large communities that we worked with, and really engaged the systems. Their marketing departments with their systems were incredibly helpful in getting the word out into the community and beginning to saturate their areas with the Choosing Wisely messaging. Then we went into the cost of care conversations in the clinical visit, dealing with question number 5, how much does it cost? And I'll show you some tools and resources and kind of explain how we rolled that out with the two systems we worked with as well. And then at the same time, we were working with managing chronic pain through our Caring for Maine initiative, and that's around our opioid education work with our clinicians. And that was very useful to bring in Choosing Wisely into that arena as well, especially for the patient education materials to help patients understand and proactively not choose narcotics and different ways of controlling their pain. So getting back into our initial work with Choosing Wisely, how did we really get to the point where we could work with practice teams on integrating this into the workflow? We have a Choosing Wisely toolkit that we put together specifically for this. And really in this toolkit, we've had to outline what the possible process flow would be from a patient perspective. And you'll see on the lower left-hand side, this was from the patient perspective, and what they wanted to see and how comfortable it felt for them, like when they came in and checked in for their visit, getting that wallet card or a 5-question sheet. Then, looking at the actual waiting area, are there Choosing Wisely pieces of information? Also getting this out into the community and seeing that, sharing it with others, that it's common practice. Let's always ask questions when we go in. And then when you're in the actual visit, is the MA bringing that to your attention as well? So it's been a wonderful process to go through and actually put the information together. And on the right-hand side, you'll see our Choosing Wisely question sheet workflow that takes the team members, whether it's at the front desk or whether it's with the medical assistant or nurse educator and the provider. There were some questions they could ask and then some of the scripting to go with it to just get people warmed up and becoming much more familiar and confident about incorporating the foundation of Choosing Wisely in every visit. Okay, whoops. Let me go back. This was the slide where visuals are just incredibly important, whether it's in the exam room, making the poster very visible. We have our MA who is pulling out education sheets. This is the way they wanted to provide the information. Some of it can come through your EMR. This other poster is huge. You can't miss it when you walk into the main clinic area. You'll see on portals, on websites, you'll see tables full. You'll have racks. So anyway, really does help. The 3 lessons learned that we were during this first initial pilot, 3 things that were very best practices, strategies. Number 1, educate the entire practice team and educate patients and engage patient advisors. Number 2, display signage and patient educational materials in the waiting areas. And 3, hang posters and have educational materials in each exam room. And our practice teams would also have, during their staff meetings, they talk about using Choosing Wisely. What have you learned? What are you doing differently? What have you experienced from the patient perspective? So it was very robust pilot to begin our Choosing Wisely work. So what we did from there is really to take Choosing Wisely as our basic foundation as we moved into our PTN work. And as Mary indicated earlier, we really felt that Choosing Wisely addressed key elements of the change package dealing with person and family-centered care. Obviously, collaborating with patients and families, it's a great opportunity to begin that conversation to reduce unnecessary tests, and then just eliminating waste whenever possible. And so our practice facilitators who work directly with the practices really are folding out, rolling out how Choosing Wisely can assist the practices to meet the priorities, whether it's a hypertension outcome measure or depression screening or any other type of measures that they're really working on, and also to integrate and cross-cut all of our person and family engagement metrics into that QI work. And so they began to work with practices to place Choosing Wisely into the practice setting, whether it be starting out with the rack cards, the posters, the individual pieces of different information, whether it be imaging for low back pain or any other issue that we have patient education materials on. And first, there we go. And so as we began, we really call this our third spread into our PTN work. We initially worked with aiming at decreasing unnecessary imaging for low back pain. And we had some eye achievers who were really working with low back pain. We have an orthopedic group working with us in coastal Maine. We have a large health system in the mid-coast area that really began with Choosing Wisely and has continued through and working with low back pain. And it's been an incredible opportunity for them to see results, and it's been great for us to see that as well, working with just Choosing Wisely and working through the QI process as well. So we integrate all of this together to really make a big difference. And then we have gone into clinical team and patient interventions with cost of care conversations, and also looking at changing up the patient decision aids to include cost comparisons with the type of treatment or procedure recommended. Some wallet card of resources, a nudging poster, which I'll get into as well. And then some next steps will be looking at imaging for uncomplicated headaches, looking more at information and increasing information for patients on decreasing emergency room utilization, looking at more at chronic pain, and also looking into the behavioral health arena. And for some reason, my slides don't want to advance. Okay, there we go. So when we're looking at cost of care conversations, that's that number 5 question, how much does it cost? Our pilot really looked at figuring out how to introduce, so now we have the Choosing Wisely conversation and workflow, but how do you introduce a cost of care conversation in that as well? And so we dealt with low back pain. So our 2 health systems, which had 6 primary care practices, and we introduced a sample practice workflow, which you'll see here on the left. And it really was a pilot template that they could change up, and they found that they kept continuously improving their workflow. Perhaps the trigger question they chose to use, they wanted to change that up because patients responded to it differently as to how they start the conversation at the front desk, or whether it's in pre-huddle, pre-visit planning, looking at their patients, trying to figure out who would be the best patient to trial this conversation with. And so they wanted to continuously improve their conversation and also work with the patients and work with their team as to the best way to deliver the messages. And so on the right-hand side, you see that we actually pulled together what we call our conversation guides for team-based approach to this conversation. And it really did help and provide guidance for each member of the team to take that and figure what the best style and way that they would like to have that conversation. These conversation guides are built off of the 4E model of communication. Like, for example, when the MA's role is when rooming the patient would be guided to say, we want to help answer any questions you may have, including any treatment options, and if you have any concerns about the cost for different treatments. And also, they would then review a patient educational information that is written in plain language with pictures and visuals. They felt that was very important. And so, for example, the provider's role when talking with the patient, they would set up the conversation. They may want to say something like, our goal is for you to get the best care with fewer problems and lower costs, and this may involve us asking new types of questions. At our practice, we feel that conversations are important because of increased deductibles for all of us and the increase in healthcare costs overall. And that cost does vary for different types of treatments. So then they go on to engage the patient, to empathize, educate, and then enlist the patient by partnering with them on their care for the best course of action. And they may say something like, I know that finding out the cost of care, treatments, and services can be very difficult. And someone on our practice team will work with you to find out the costs that you can expect for the different treatment options we talked about and that that I feel are best recommended. So these conversations, we can go into much more detail, and I can also work with people in detail once you do take a look at these materials that are available. This is part of our patient decision aids created for the cost of care. And also we focused again on low back pain, but this can be transferred into any type of procedure and test, and even medication use. And also it really was brought into our shared decision-making process seamlessly. And also, if you have a state that has a public health care cost reporting website, I would recommend incorporating that as well. Ours is comparemaine.org, and it's very helpful to get the word out there about where to find your costs. How can you find out more information? The wallet card you see here is, we really wanted patients to be more engaged and directed to take charge, to find out costs. So being to know about healthcare costs, there's 5 questions here. Where can they go? How do they start the conversation? On the reverse side of the card are our different health insurers, as well as our consumers hotline to find out more about how they can gain health insurance. And so we also have a nudging poster. You'll see this water fountain over here on the left. That was a fairly large sign that we call our nudging poster, and it basically says, do you have any questions about your healthcare treatment and costs? We want to help. And so there was different ways that we could help you. As you come in, sit, wait, you can kind of see the culture that's been created in that practice, that we want you to ask questions. We do care about the cost of your health care, and we want to do what we can to assist you in ensuring that you can have the care that you need, that your outcomes are increased, and we're decreasing costs to all of us and the system at the same time. This is a slide I threw in there just so that you can have easy access to a lot of the materials that I've talked about today. And if you have a problem with some of them downloading or something, just let me know and I can certainly help you out. These we're quite excited about clinical outcomes early on with our PTN work to reduce unnecessary testing and procedures. We were able to reduce unnecessary images for low back pain, and also really to not expose patients to radiation, to unnecessary testing. So that's very exciting for us here in northern New England. Now this, I know Mary mentioned this, these are, and they're very hard to see here, but obviously the documents are attached here for you to download. We really started out on the bottom crosswalk, the Choosing Wisely crosswalk, to achieve the 6 PFE metrics. And we use Choosing Wisely to achieve every single PFE, person and family engagement metric, through our TCPI work. It was very exciting to see how we can do that, to at least create that basic foundation of achieving each one of the 6 PFE metrics. And so you'll see here, and I don't think I have time to go into much detail, but you can see electronically there's documents that you can refer to assist with your practice coaches, your quality improvement coaches, to really take Choosing Wisely to the highest degree and utilize it to achieve PFE. Now also we wanted to look at and crosswalk to how then can we achieve the aims, TCPI aims, through PFE, through Choosing Wisely. So this gives you a bird's eye look as to when you're looking at the PFE interventions. You can see Choosing Wisely takes a large chunk of how we want to approach and achieve the different aims. Aim 2, improve health outcomes. Aim 3, reduce unnecessary utilization. Aim 4, generate cost savings. And Aim 5, reduce unnecessary testing and procedures. So I would suggest you take a look at those. If you do have questions about how we implement some of this, I'm very happy to take your call or your email. And also, we have some who are very interested in how we use PFE to value-based care transition. And early on in our presentation today, we talked about MIPS and how working with that, and this is an example of shared decision-making, PFE metric number 2, how we can look at that and see that there are different improvement activities that can really be valuable in working with and achieving this metric, and through increasing your MIPS score. We have a few online educational modules. Recommend that if you'd like to take a look at it. We have Improving Patient Outcomes with Cost of Care Conversations in the Clinical Practice. This was our work with our 2 health systems and 6 primary care practices. The tools are in there. We have clinician perspectives on why it's so important to include cost conversations in the care of patients. Also, on the patient side and the consumer side, spend your healthcare dollars wisely. We really felt that we needed to improve the information available for consumers on healthcare costs, where you can find out more information. And then also, this was just one of our examples of our low back pain backpack for our NNEPTN practices, in describing how all of Choosing Wisely can assist in achieving all the PFE metrics as well as the aims. And that's it for me. Thank you so much. I'm very happy to work with anyone later on if you're interested to go much deeper into the dive of Choosing Wisely and PFE and TCPI work. Thank you.
Great. Thanks, Kelly. I noticed that there were a couple questions, really good questions, that came in as you were talking, and we'll make sure that we save enough time to answer those questions. I'm going to take just a minute to to chat a little bit about a tool that we created that we hope will help you very specifically invite patients and families as implementation partners to Choosing Wisely. I'm assuming that based on the great presentation that the 2 Kellys provided to you, that you see that there's some real benefit to your organization in implementing in a robust way the Choosing Wisely tools and connecting them to the aims that you have for your particular practice. But there are a number of practices, and Kelly alluded to the work that they did with patient and family advisors, but there are a number of practices both inside TCPI and outside that have invited patient partners to with implementation at all different levels, at the system level, at the national level, at the clinic level. And this is a colleague who I've worked with, Janice Tufty, and she's a patient partner. And she, when we were getting ready to do this presentation, I wanted to get some thought from a patient partner who'd been involved in implementation of Choosing Wisely, both as a patient who'd experienced those conversations with her healthcare provider, but also in the different work that she did. And so one of the things that she shared, and I'm not going to read her quote, you can read it yourself, but basically she became aware of Choosing Wisely because of some of her kind of national work. And then as she was interacting with her healthcare provider, her primary care provider, she noticed that they had implemented some of these tools and became an advocate with them on the extension beyond that of those tools. And then because patients and families don't necessarily see all of their providers in the same healthcare system, she became a very activated patient in terms of ahead of time when she was going to see other providers for a specific condition, new diagnosis is something that she would reach out to the Choosing Wisely website and find out what kinds of information was out there so that she could go into the organization as a very informed consumer and ready to have those conversations with her patients and families. Okay. So one of the things that's really important to think about is that there are lots of ways that patients and families can help you in the implementation. They can help us understand how to introduce practice changes, how to introduce those new conversations, because as Kelly was talking about, this is a real culture change. If in fact what your patients have experienced is coming into your practice, being told what are the procedures that are recommended by you and not really having a full transparent discussion about the pros and cons and the opportunities that there might be. So when you're making that kind of change, working with existing patients on that can be really important. Identifying, there are lots, I hope you got from the presentation, there are lots of different tools beyond the 5 questions among the different specialties and different conditions. So it can be overwhelming. So you want to start small. You want to start with in areas where both you and your patients feel that the tools would be useful. Patients are in our space and see it differently in our clinic spaces than we do. And so where we might want to place materials may not be the places where patients and families might suggest. And so we want to have a really robust both and kind of way of looking at things. And then as you're implementing in your plan, do, study, act cycles, you want to be sure and integrate the patient and family voice into how successful has the implementation been, what kinds of additional questions have patients and families had. And what's really true is that when we begin to have these conversations, both care conversations as in choosing wisely, but also conversations about how to implement important tools that are out there that we can bring into the practice. Advisors can really help us see things differently. They can reduce the burden for a healthcare team. One example is a patient and family advisor council at one practice identified an important message poster that, that they thought should be throughout the clinics. And they actually went out, volunteered and went out to a couple pilot clinics and placed posters around the area and helped evaluate how effective those were from the patient and family perspective. And then have kind of a standard way that they rolled that out to a variety of the clinics. They didn't do this in isolation. They did it as part of partnership with clinic representatives, but they actually kind of rolled up their sleeves and really helped. And so sometimes we don't think about that as a resource, but they definitely are resources and they can be very enthusiastic. Now, one of the downloaded tools that you have is what we're calling inviting patient and family participation in the implementation of choosing wisely tools. And basically this one-page back-to-back document really helps you think about the questions that you might want to ask yourself as you're beginning to think about an implementation, and then lists 11 different ways just to get you thinking about what are some small and large ways that you can begin to invite patients and families in. And if you're a small rural practice, we want you to know that you don't necessarily have to have a patient and family advisor council to integrate patient and family voice into it. It can be sitting down with one patient and sharing a choosing wisely tool and getting feedback about that and hearing how they would have preferred to have that conversation initiated by their practice team and those kinds of things. So we hope that you'll find that the tool very practical with ideas of how to get started in inviting patients and families into the situation. So that's one tool. I just want to remind you again about the breakthrough series with Choosing Wisely. It's always nice when you're trying to implement something new to have support from colleagues and from people who've done it before, and certainly Kelly Rand and her group are going to be able to help you with that through the breakthrough series. So be sure and take a look at that flyer and become involved. We also want you to know that there are a couple other materials that are available, and for some reason I can't get the slides to go, Jacinta, so if you want to move them along. But we have a patient and family centered care website called TFCC Connect, and it's a free online community where you can network with others and share ideas. It's a free online community, and we have a special topic group just related to TCPI conversations, but we also have a wealth of other members on this community in the general community, so you can surface questions, have discussions with other people, share materials that you have created, and we really recommend you to check that out. It's open to clinicians, quality improvement facilitators, patient and family advisors who are working with different practices. So that's something to consider. And then if you have not been out to the Patient-Centered Primary Care Collaborative website for TCPI, they have webinars on recording, tools on how to launch with patient and family advisory councils, and other kinds of resources to strengthen your PFE efforts. And they're just a click away. So I really encourage you to do that. And they really break it down based on some tools for patients and caregivers and clinicians and care teams, and also people who are the QI professionals who support those care teams. So I want to thank you very much for your time. You've heard a wealth of information, especially from the two Kellys, related to the actual implementation of the Choosing Wisely tools. And there were some questions, so I'm going to turn it over to Marilyn to facilitate that conversation and surface those questions so that the Kellys can respond to them. Marilyn?
Hi, Mary. Thank you. This is Jacinta. I'll go ahead and take over. So we have one question from Ashley, and she wants to know, how do you foresee behavioral health or mental health providers in primary care participating in this process? So basically participating in the Choosing Wisely campaign in the process of communicating with the patients and the providers. And this question can go to both Kelly R. and Kelly SV.
Kelly R., do you want me to go ahead?
Sure. So I think that one of the things that we have seen throughout is that different patients feel comfortable with different care team members, and it's important that these conversations happen with more than one, more than just the clinician. The clinician in an individual practice might not be the perfect person to have the entire conversation. Certainly they have to be part of it, but I think that particularly if people are concerned or have anxiety about not having a test or treatment, the behavioral health and mental health providers could be a great part of the care team. It really does need to be a team approach when talking about these things. I also think that when starting the process of involving patients in the beginning, that it would be great to get behavioral health both to give input on who the patients are and also to share their expertise in what might happen in that patient involvement. But I'm sure that Kelly Cabbage also has more to add.
Oh, I think you very much put it together. We've been wanting to incorporate behavioral health organizations' needs and tailor Choosing Wisely. And so right now with our work in APTN, working with our practice facilitators who are now taking questions and concerns from the practices and how we could implement and broaden the messaging, not change the materials, but how to incorporate various Choosing Wisely materials and really looking at involving care team members and also support specialists who work directly with the clients, and also to ensure that some terminology and the language is familiar to those working in the behavioral health environment. So we're kind of looking at that now. It's one of our future activities here, going from here on out, that we really want to be able to make our Choosing Wisely material resonate into the behavioral health environment and population. So we look forward to being able to work with peer support specialists who were clients and now are peer support specialists, so their points and their ideas, their thought process will be very informing to us as we move forward.
Thank you. We have one additional question from Bill. He wants to know, was there training for clinicians to have conversations with patients who wanted additional care than the best practice treatment that was suggested? And this can go for both Kellys as well. So if a patient is, or if the clinician is aware of Choosing Wisely and they're trying to explain it from that perspective of reducing unnecessary testing, but the patient is still asking for additional care, is there training for clinicians to kind of continue that conversation with the patient?
So I did put 3 links up, and hopefully we can share those links. But we have developed modules on how to have a conversation, which does include having a patient who feels strongly about having a test or treatment. We have a few modules that are about discussing the cost issues. There's one module that Cognito created that actually lets you stimulate from both the patient and the clinician's perspective. So it could be used either as a clinician training tool, but it could also be used as a patient tool to let them know how they can have these conversations. And that within that tool, there you can pick a patient who is both fairly agreeable to the idea or a patient that there's more barriers to having them believe. But I would also say that it is a process, it is a culture change, and there you may not change all patients' opinions on the first time, but I think having training so that people can start getting comfortable with those conversations is an essential part of starting that culture change.
Yeah, Kelly, and I think that also part of our work when we were piloting is actually having the teams share their experiences, having the providers share their pain points, how can they gain better strategies, what's working for others, how did they approach it, whether they're working in their team with their PAs or their MPs or their other physician colleagues, and then gaining insight from that multidisciplinary approach from the different team members, how they're working with that. And also noticing that, okay, if you're not that comfortable, the conversation was like, well, who can we have on our team to who's naturally gifted to have these types of conversations? So it doesn't always have to be that you have to be the one expert or have that pressure. Just being able to share that opportunity amongst your team members, or even your system, if you're connected to a larger system, trying to find out what's already available, who's already there. It's the patients that we've heard from, it's not that they have to have an immediate answer. They just, number one, want to know that someone cares, that they're concerned about the cost, for example, or having another way of approaching the issue. And I'm sorry, I'm concentrating on cost, but that's kind of where my mindset is right now, is we're reducing utilization and cost and having those cost of care conversations more readily. But that's just my 2 cents in working on that. And communication skills, we do point people towards Drexel communication modules that can provide to help get over that. And also to hear from other providers who start scraping their knees on having these types of conversations, where they are now in the progression of having it. And many of them feel that if you're not having these conversations, you're practicing unethical medicine. So I've really have seen a huge transformation from 2013 to now, when we couldn't even approach the cost question back in 2013 in our first pilot. Now we're trying to figure out, and have moved way beyond to get at, well, how can we refine what we're doing and make it even better? So it is a process. It's a transformational amount of work, but there's a lot of people out there that can certainly assist and provide that confidence and experience.
And one last thought to add on to that with the patient engagement. One really innovative group that I did see at one point did use patients to help do those trainings. So having clinicians and some patients who were already prepped and trained and encouraged, thinking that this is a training, simulated the conversations and then had really honest conversations about why they said what they said on both sides, which I thought was just a terrific way to do it, but also gives you gives the clinicians who are in that training a better idea of why a patient might be pressing.
Well, thank you so much for your responses, and thank you so much for our attendees for asking such great questions. We are at the top of the hour, so I'm going to hand it over to Marilyn to close us out. Marilyn?
Okay. Hi, I just again would like to thank you for participating in this webinar, and thank you so much, Kelly, Mary, and Kelly, for providing such great information. And so we hope that those of you who have joined this webinar will join the effort. Our contact information is in the slide deck. Both it's Marilyn Francis and Jacinta Smith, but we also have in the slides, as I was saying, the contact information for Kelly, and Mary. So wish you enjoy the rest of your day and have a good weekend. And we hope to, as I say, I hope you will join the effort. Thank you.